gives me great pleasure to introduce my first annual report on the health of the Isle of Man. First one that I've done since I've been in post as Director of Public Health, and actually the first report that's been published since 2004. In order to produce this report, we have spent the last 2 years actually building up some core data sets of health and wellbeing indicators that we can present to give an overall picture of the health of the population. This is the first output from an ongoing piece of work which will enable us to update the indicators year on year to track the progress as we work on different areas of public health and hopefully see change over time. The full data sets will be published online, so everybody will be able to get access to them. And the idea of the Director of Public Health's annual report is to pull that data together into an overview on health and wellbeing, which we hope will be easily read and understood by everyone, including members of the general public and people who have no background in health data or health intelligence. What we've done in our first report is focus particularly on the lifestyle risk factors that are amenable to change. And the major groups of those are smoking and tobacco consumption, overweight, obesity, lack of physical exercise, excess alcohol consumption and drug misuse. And we know from repeated studies and some very good evidence that's been gathered worldwide over many years now that if we could reduce the prevalence of those risk factors across our population, we would make a significant impact on mortality, particularly mortality below the age of 75, and we would also improve people's quality of life massively because we would reduce that burden of ill health which currently people are having to live with. Reducing risk factors across the population isn't something that can be done to or for people by the health service or by government generally. Ultimately, it requires changes, often quite small changes, by each and every one of us. Changes we make either for ourselves or if we have a family, particularly if we have young children, we can make changes that will impact on that whole family. And for our children, we can set them up to have a healthier life and set them in good stead for the decades of life that they still have to come. We've presented our findings in the report by trying to map the risk factors across the life course to show that how they affect us at the different stages in our life. So for children, the lifestyle risk factors for them actually start to kick in even before they're born. And we are seeing worrying levels of obesity in pregnant mothers who are booking for antenatal appointments, where over a quarter of our mothers are already obese. We're still seeing more smoking in pregnancy than we would like, with about 11% of our mothers still smoking. When we come on to early infancy, our rates of breastfeeding are much lower than they should be, and we need to do work there. All of those things would set our children up for a much, much better start in life. When we come on to look later in childhood, we find that at school entry, 9% of our children are already obese, and over a quarter are overweight or obese. So again, that's something we need to do much more work around, to look at the factors that are influencing that and to help families address it. Tooth decay is also a problem, with over 25% of our children having decayed, missing or filled teeth at the age of 5. The problem there is almost worse than it sounds, because what we have is a sharp divide between the 75% of children who have no tooth decay and the 25% who probably have multiple teeth affected. And that has a big impact on those children's quality of life. And again, it's something that is eminently preventable if we can just get ourselves together to find the ways to put into practice the evidence that we already have around that. Coming on to school-age children, whilst obesity still remains a problem, we are beginning to see worrying levels of psychological stress emerging in our children. Some of that is associated with bullying, and particularly a shift from what used to be more of a physical bullying culture to one that's more related to cyberbullying, use of social media and so on. Children who don't learn the way to cope with psychological stress effectively when they're young are set up for a life where they are more likely to have psychological and mental health problems and more need to actually be seen by specialist mental health services. So we would very much like to start some discussions about how we can improve mental well-being in schools to actually prevent the problems occurring and give children and young people the coping skills to actually manage their stress at a very early stage. When we come on to looking at working age population, again, some of the same problems are evident. 60% of adults are now overweight or obese, and clearly that's something that we really need to turn around if we're going to cut into the problems that arise from that, which are linked to type 2 diabetes, to cardiovascular disease, and some of the common cancers. We're still seeing more smoking than we would like, with around 14.5% of our population still smoking. That's better than it has been, but there's still a way to go, and it's still our top preventable risk factor, although it is rapidly being caught up by overweight and obesity. Again, we have high levels of psychological stress in the adult population, particularly around depression and anxiety. And as with the children, that's an area where if we could just get in early, teach people coping strategies and early interventions for those who need the next level up, we could prevent some of these problems becoming chronic and empower people to actually manage their mental health and well-being much better than we're doing at present. In older life, we have some problems around falls, which indicates that people's stability is not what it should be, and that maybe their home environment has elements that are actually leading to falling, and where simple interventions delivered by professionals who visit the home for a variety of reasons could make a big difference and prevent those falls, which are often in older people the first step to them having to leave their home and move into a care setting, which is not good for their quality of life and also puts a huge burden of cost on the health and social care system. We need to get better at some of the preventive activities within older people so that we get to a culture of having active ageing rather than a dependent ageing culture. There are some things that we need to work harder on, such as increasing uptake of flu immunisation amongst older people, because our levels are low there and lower than England. We also have high levels of visiting to the emergency department, actually across all our age groups. And there are issues there about whether that's the best use of the emergency department, whether we can support people to look after their minor ailments better themselves, and whether we can provide quick access to help for minor ailments through other methods, such as an increase in the pharmacy scheme that works with people to do that. And finally, when we look at the last point on the life scale, which is really how we leave our lives, where we die, we find that at the moment we have only 40.8% of people dying in their homes, and that is again significantly less than we would expect, the figure for England being around 48%. And that's about how well we're organising our community services in the widest sense to actually support compassion for people who are in the last phase of life and enable them to make a fully informed choice of how they want to spend their last days. So really from cradle to grave, there is a lot that we need to be thinking about. And I hope that my report, which can't actually set out concrete proposals about what we're going to do, because this needs us all to come together really across government and across communities to start having the conversations about what we can all do together to play our part in improving health and well-being outcomes for all of us.